All right. So I'm now going to go ahead and introduce the panelists. Johnson was a coordinator of an overdose prevention site at Parkdale Queen West Community Health Center. They currently work as a health promoter in a safe consumption site. Samia Gomes is co-founder of Earth Action Hub, a global youth-led event and platform centered around positive climate and environmental action. And she's also a project coordinator with Dandelion, a Brazilian-based NGO. I'm going to say it in English because I will butcher it otherwise. And Flávia Santos is a project coordinator with Dandelion as well. So welcome all of you. I'm wondering if maybe I can just pass it right over to Samia and Flávia to talk about Dandelion and the work that you do in Brasilia, and just to start giving a context that way.
Sure, thank you, Andrew. So Dente-de-leão, in case you are wondering how you say it, it's an NGO that we created in 2018, I think. But we have been doing work with vulnerable populations here in Brasilia, the capital of Brazil, since 2015. We focus our work in homeless people, with homeless people. So we have different projects, always trying to help with, especially giving back some dignity and some visibility to these people. It's our main focus. We are not an NGO that has a lot of resources in means of money. We can't really give a lot in these situations, but we realized that our work just in harm reduction especially, it's more important than like giving clothes and money and like financing these kind of things. And I think that's a good general idea. Do you want to add something, Samia?
Maybe before I pass over to Matt, can you give a bit of context about the current state of harm reduction, in Brasilia, and how easily is it accessible? How easy to access our harm reduction supplies and harm reduction policies? Can you give a general context that way?
Yes, of course. So our NGO and every other collective and NGOs and nonprofits and organizations here in Brazil that work with harm reduction, they are going against the government. Our government is strictly prohibition, and it's very since 2018 especially, it's very closed to any other kind of more human approach to social issues in general. And these organizations are always like a counterattack of the prohibition. We also have a very big problem with drugs. I think it's different from North countries, because usually people here, especially in Brasilia, that I can speak from experience, they go to the streets because they are homeless and they are without jobs, and then they turn to drugs. They don't go to the streets because of drugs and then they lose their jobs and their houses. So it's like a different effect from São Paulo, for example. It's a little different from Brasilia. So yeah, we don't have any support from like the government. We have a little support from small secretaries and small politicians that understand a little bit better the situation and try to help with the harm reduction initiatives. But basically, we are fighting a war against the war against drugs.
Okay, perfect. Thank you. There's so much already that you've said, that we should definitely get back to. But Matt, to weigh in, can you just first talk about your own experience with harm reduction work, and maybe where you're coming from in this kind of activism and work?
Sure. First of all, I'd just like to apologize. I have a cat that's is walking across. It's probably gonna come back. She's gonna come back again. Yeah. Um, so I got involved with harm reduction work as a service user first. So I was a street involved injection drug user and accessed harm reduction services. We have these programs here for service users to get involved in delivering services. They're called peer programs. And so I started off joining a peer program where I would go out with a partner on bikes and hand out needles and condoms and pipes and things to folks on the street. And then often outreach teams are kind of the first workers or the first faces that people see and communicate with, and then are really the conduit to like connecting people to greater services. So I fell in love with the work. It brought like such a sense of meaning to my life, and my prospects looked very bleak at that time. And so I wanted to do more of it, and I wanted to get more stable work in this field and more responsibility, and kind of just grow that part of my life. And so I did more and more and more until I hit this spot where I was told by a manager to not apply for any more jobs because I had gone as far as I could go. And it was sort of like this, I'd gotten this one last position. They were like, this is like a gift. And so don't question and don't ask for more. And I sort of was like, well, but I want to. And so what would I have to do? And they were like, it's impossible because you'd have to go get a degree to do that. So I then went to social work school and then graduated as a social worker, and then started the first place I wanted to start was in coordinating those types of peer programs. The people I had as my supervisors were all fantastic, but none of them had actually come up through the programs. And I always saw that as being a missed opportunity. So I did a lot of HIV work, I did Hep C work, and did a lot of street outreach work as a coordinator. But then around 2016, more and more of our street outreach work was focused on overdoses, as the numbers here did this really sharp spike. Overdose rates have been going up here for the past 20, 25 years, but in 2016, 2017, they started to spike really drastically. So yeah, we were really focusing a lot of our energy on responding to overdoses and training people on using naloxone and responding to overdoses and things like that. And so my whole career took a shift in focus. So I started doing more and more of that kind of like workshop stuff. Then in 2017, me and a few other folks from Toronto started the Moss Park Overdose Prevention Site, which was the first overdose prevention site in Ontario. It was a result of inaction by the government. There had been 3 official sites that had been approved by the federal government, but the provincial government was dragging their heels on just signing off on their part of it. And so every time there was another death, either from our clients or in our personal lives, it was just, you couldn't help but connect it to the fact that these places should be open and they're not. And so people didn't even have the option of using it in a safe place. So we opened in a tent in a park in the downtown east side, which was a real epicenter of the overdose deaths at that time. And then after that, I started when the sites, the sanctioned official sites that are funded opened, I started working in those. So I ran the overdose prevention site in Parkdale, and then because of various government things and funding issues, it got changed from a particular overdose prevention site model to this other model called a safe consumption site. And then when that shift happened, I moved with it, but took a different role as a health promoter. So now my job is to work in the site on a day-to-day basis, but I also do a lot of popular education and training and workshops. And so I go throughout the city and train people at different organizations on how to do a more robust overdose response and overdose prevention.
Amazing. Yeah, such a good wrap up. I guess like, yeah, my first question is, Flávia actually mentioned, the war on drugs, right? And I feel like in the context of Toronto, harm reduction discourses and ideas, or of treating addiction differently are starting to really get some traction. That's my sense. But do you feel like, Matt, that we're still in a war on drugs here? Do you feel like we've reached that point of getting beyond it? What's your take on?
No, we're still stuck in the quagmire of the war on drugs. And unfortunately, as harm reduction, so we were talking about this kind of before we started a little bit, that the word harm reduction is getting more traction, and more funders and organizations are putting it forward as part of their platform, but without really doing a lot of like searching into like what that means and how do they need to then shift their policies or change different practices to fall in line with that. So the word harm reduction is getting divorced more and more from fighting the war on drugs. So for a lot of people, harm reduction means like I'm handing out needles, but it from me and where like my friends and colleagues come from, if you're not actively fighting the war on drugs, you're not really doing harm reduction work. And you always have to have that kind of like micro and macro lens. Even so, like we do the most micro level work of like trying to keep people alive till today, but we have to be fighting that bigger fight, or else we're not, if you're not fighting to make your job unnecessary, then why are we even here? It's kind of the idea.
Yeah. And yeah, like the other question I wanted to just bring in, before we just open it up totally to everybody, was around just theories of social change. So, what does everybody on the panel think in terms of your different contexts of, what's the major lever or, institution that has to shift before everything else becomes possible? Is it the federal level of policy? Is it the community within Brasilia or Toronto getting behind harm reduction ideas, and agitating that way? Just wanted to gauge how you see the context of future action and progress. So maybe Samia or Flávia, would you mind just weighing in on that?
Well, I was thinking that's a tricky question. I guess in Brazil, probably many countries, drugs are seen as a bad thing. Like we have this, when you talk about any type of drug, except maybe for alcohol and cigarettes, because they are legal, so they are harmless. But people see it as a very awful, scary thing related to very poor people, to how do you say, being kidnapped, jail. They are all in the same field. If you would do an image around drugs, it will be just awful things. And people don't even associate, maybe I know people that were addicted to painkillers, for example. We don't think about the legalized drugs. We are always thinking about all the forbidden things and dark markets. And it's very hard because now I see a little bit more the discussing rising on harm reduction because of the use of cannabis for medicine, and with all these countries legalizing it, and we are seeing good results, people using oils for autism, for many other disease. And now we are talking about it, but if you talk a little bit on the side of that, is already bad again. So we still have a long way to go, I think, in all the levels. Basically, we are now in a very hard moment. As Flávia said, politically, we have a very conservative stakeholders, if I can say, like all people taking decisions, they are very conservative and focused in anything else but social problems. And drugs are bad. Nobody wants to discuss that. They are used by poor people. And okay, after we will discuss about that. It's not a priority. And it's not also the reality. People are dying every day because of the war on drugs. Rich people use a lot of drugs because they have money to buy the expensive drugs that are in every party you go. And we have non-scandals with politics, using drugs, using federal like rooms and meeting rooms to use cocaine, for example, but they are somehow not put in the same war zone. So I think we have many challenges to go from community to see that drugs are here, people are using it, even if it's forbidden. So let's face it and do something about it. And if you go to decision makers, they don't want to go ahead and talk about it because they will be stigmatized as, oh, so if you vote in favor of legalizing things, so it means you use it, and nobody wants to be linked to this image of users. So yeah, I think we have many challenges, and we also have race, how can I say, race issues, like poor communities are usually Black communities, and they are the ones selling drugs, and people using expensive drugs are white people in rich neighborhoods. So it's a very complex issue, in my opinion. I don't know if Flavia has something else to add, but I don't see any easy solutions, it's like so many levels.
Yeah, exactly. I have the first step that is take out the president, but after that, it gets more complicated. We do have a lot of interested parts, powerful parts, very conservative. But I think, as Samia said, that the conversation is rising in society, especially with young people, and especially because it interests them. Because harm reduction, this term is being known now because of parties, because they want to go to parties and they want to use ecstasy and they want to use their drugs and they want to be safe, and they think it's interesting that they can use in a festival, for example. And after they learn about the name in this context, it's easier for us to bring to them the we call here harm reduction in parties and harm reduction on the street. So it's easier for us to bring the street conversation. Not so easy, but it is easier, and there is an opening in society. But as Samia said, the biggest problem is that we still have a very divided society, like Black and poor people and white and rich people. So harm reduction discussions in parties are for white people, are for rich people. So it's easier to have this conversation. And the kind of drugs are different too. And as the other side, it's more difficult to open this conversation and to have like harm reduction policies and these kind of things, because it's for poor and Black people.
So much in what you were saying. One thing I wanted to draw out and maybe get Matt to weigh in on was just around the legalization of marijuana, because that's something that we've just gone through, and I'm wondering, Matt, what your perspective is on how has that changed anything in terms of conversations about drugs? Does it make anything in terms of harm reduction easier to access?
So I think in some ways the legalization of cannabis here has made a fight on the war on drugs harder. What I see as being the biggest barrier to change here is certainly the federal government. Justin Trudeau, sorry, let me just turn that off. So my phone is moving off. Justin Trudeau clearly saw cannabis legalization as one of his big moves, and it's going to be part of his legacy. And he didn't want anything to stand in the way of that. And so he absolutely did not want to connect cannabis legalization to ending the war on drugs or legalization or decriminalization of other things. And so he just won't have a conversation about it, even as like his medical officer of health, and other high up politicians have espoused the belief that decriminalization at least is the way to go. He just won't even have a conversation. And it's certainly connected to this like we've already done the cannabis legalization. Let's just slow down. We're going too fast, kind of thing. So that's frustrating. But like, obviously, anti-drug user stigma still exists, and it's a big issue. But what we saw with cannabis legalization was, in the years before it finally became legalized, the majority of Canadians, when polled, were on side with this happening. And there is this big movement right now in favor of decriminalization, at least. So, like the Association of the Chiefs of Police have signed a statement saying that they support decriminalization, or like a version of decriminalization. Most medical officers of health are on side with decriminalization. So at this point, like a lot of the stakeholders, a lot of the power players are pushing support, and there's definitely a lot of community support. I think some of that goes back to the the way that race is seen as connecting to drugs, whereas here it's been a little bit different, because with fentanyl, the media has put out a lot of false impressions, and one of them is that fentanyl isn't everything. And so if you smoke a joint, it could be laced with fentanyl and you're going to die. But that's led people to really worry about white kids from the suburbs who are going to experiment with pot or something like that. And there are these powerful groups like Moms Stop the Harm, who, a number of years ago, I don't see those same folks standing up, even if their kids did die of overdoses. I didn't see a lot of like white suburban moms standing up, speaking really openly about their children dying of drug overdoses. But that's sort of changed. But with that change of like a conversation about everybody's at risk, instead of just particular communities, it's then made that conversation easier to have, and has gotten a little bit more political support behind it, unfortunately. Obviously, in terms of incarceration rates, it's still heavily skewed around racism, and Indigenous people and people of color are incarcerated at much higher rates than white people, although white people use drugs at higher rates. But yeah, so I think right now, going forward, I see the municipalities as being the driving force behind a push against the war on drugs. So Toronto and Vancouver have both put forward requests that drugs be decriminalized in those municipalities. And I think it's going to go forward because, in the middle of the country, in Saskatchewan and Alberta, where they're really fighting a hard fight, and there's a lot more conservatism and pushback against this, the federal government, the prime minister, doesn't want to enforce decriminalization on them where it's going to be unpopular, but then kind of wants to have it for the people who want it. So if Toronto asks for it, they can say, yep, you get it, but they don't push anybody else to get it that doesn't want it. So this is kind of like cowardly way out of supporting it, flip-flopping it, and like supporting it and not supporting it. And that's falls in with like everything around harm reduction in Canada, where it's always Vancouver and Toronto get a lot of it, and most other places in the country have none, regardless of death rates or HIV rates or Hep C rates or any of the driving force behind why we want these things. So definitely the federal government, I think, is or federal government and some provincial governments, I think, are the people standing in the way. The other thing I will say, though, is unfortunately we've made all these strides in terms of a robust conversation about decriminalization, but again, the definition of decriminalization is maybe the problem. So they're trying to hang on to the last vestiges of the drug war, even in talking about decriminalization. So instead of just having decriminalization across the board or even legalization, they want decriminalization of small personal amounts, and then focusing more money and attention on the international trade or trafficking, and not even the international trade, but just selling at all, which always hits poor communities, especially poor people of color who are doing sort of subsistence selling with the lack of like other options to exist. So although I support decriminalization, I support these efforts because it is obviously so great for the people who are dying and things like that. We are going to have another big fight to try to connect this decriminalization movement more and more to ending the drug war in all of its forms.
Wow, yeah, so many good points in that. I mean, I have so many more questions, but I feel like I want to open it up and allow Alice or Tina or Miriam or anyone to weigh in. You can either just raise your hand or just feel free to jump in. Any questions? You can come up. Okay, well then I'll start asking some questions, but at any point people could just definitely feel free to jump in because I've already been talking too much. In terms of, maybe you'd like to go back to Sammy and Flavia, like when you think about the community that you're working with and supporting through Dandelion, getting away from policies and thinking about what you see and hear from them, like what do you think is like the most urgent kind of need in terms of really making a difference in standards of living and what people are asking for in terms of a change?
I think lately in the projects that we have been working with vulnerable populations during the pandemics, the main concern is housing for the people, because they have some houses. We have been working with a few communities that have houses, but they are not very good. And our government in Brasilia, not federal, it has been, during the pandemics, it has been destroying these small urban occupations, and have like evicting these people and destroying their houses and taking their things. So for these people, I think it would be housing, their security, like they don't need another house, but they don't want their house to be taken apart. And for really homeless people, like the ones that are in the middle of Brasilia and live on the street, really, I think food is the main concern. Because usually it is.
Oh, sorry. Yeah, we have seen in the last few years, population is going really poor. We are in serious economical trouble now. And I don't know if that's the right name, but we have like the inflation, like the rates, taxes, everything is so high that basic items are very expensive now comparing to a few years ago. So I don't know if 100 reais, which is the currency here, if you could buy food for a whole week, now you can buy food for 2 days. So it's crazy, like it's not easy. And even the supplies, all the supplies, how do you say, the gas to cook, it's very expensive. So people now are going back to use wood and doing fire pits to cook, because they cannot use their oven because they can't afford gas. And now we have many child and especially women with this burning going to the emergency rooms, because if they buy the gas, they don't have money to buy the food. So we are in a very weird situation now. Like we feel like we have gone back to 10 years ago, where we had also high rates of poverty. So food has become the basic need again. We have like overcome that, and now we're back. And that's very frustrating to people, because I feel that a few years ago, the main concern was getting some education or getting some capacity building, some skills to find a job. And now even people with degrees are not finding jobs. So we are back to basic needs. Like I just need to eat something today. This week we have a video getting viral in Brazil. It's a guy just walking by houses and screaming he's hungry, like really screaming on the streets, like, hey, if you are at home, I'm hungry. I'm just hungry. Just throw anything from your window. I don't need to see you. And it's like heartbreaking, and it's getting more common. So yeah, and then coming back to harm reduction, if you cannot eat, people go back to using heavy drugs because they want to stay just high or just sleep every day or all day long, because there's no easy solution. So it's very cheap to buy like a small thing of alcohol, like very strong alcohol. So you just drink it and you sleep for hours, and that's okay. Or you just buy crack, which is very cheap here. And then you smoke crack and you stay high for a few hours. And people are just going back to using a lot of drugs again, and very cheap drugs. We all know they are here because we see people using, and we are far from the discussion of having safe spaces for using these drugs. So now we are in summertime, which is warm, but in the June, July, we had winter, and winter was more cold than other years because of climate change. And we had cases of people like frozen on the streets, which is not common in Brazil, like really almost die frozen because they were so high they couldn't find a shelter. And yeah, problems are always, how they say, they are connected somehow. And yeah, sorry, I've been talking a lot, but I think from the food thing, we go to the drugs again, and we don't have shelter, and everything is connected.
Yeah, no, I mean, such important connections to make. Just in terms of a timeline, I mean, would you, in your experience, has that inflation been linked to COVID, or is that linked more to like Bolsonaro, like a longer term sense of inflation? Just is that like just in the last year, or?
I would say both things. I think COVID put us in a complicated situation economically, but the government made bad choices of how to use the money of the country. So now we are just like rich people kept rich, poor people are very poor. And for example, at the beginning of COVID, government paid money for a few companies, so they didn't break with the lack of economic activity. And government was helping the banks, and the banks are already very rich. Like banks would not go bankrupt, or they would not fail because of economic problems. And instead of helping like small people from small cities or just put some social program, they just put money in the bad places. So I think we have both things together.
Okay. Matt, to bring you in, I mean, a lot's been brought up now. So in terms of, how you feel maybe like COVID has impacted things, what you're hearing in terms of like the really urgent needs, like any of that, just feel free to weigh in.
Sure. And there's definitely similarities. The like most urgent need that's connected to the people that I work with is housing also. And we've seen the municipality, we've seen Toronto clear homeless encampments quite violently at a time when they've taken over hotels to put homeless people in and shelter. It's difficult to impossible at times to get shelter beds. They're taking people who are sleeping in tents in some unused part of a park and removing them. What's awful about it is then they put up these signs saying this is like park remediation, like we have to bring the parkland back, but they fence it all off so nobody else can use it. So, John Tory keeps saying like, oh, the parks need to be usable by everybody and families. And it's like, but then you fence it off so it can be used by nobody. So, the lack of housing, also the quality of housing, and then COVID is definitely exposed a lot of the cracks in our system and then widened them significantly. So like one of the issues that kept coming up again and again when people living in encampments were spoken to about, John Tory kept saying like, they'll all be offered places indoors. And people said, I don't want to go to these places. I don't want to go to these hotels because there are huge COVID outbreaks. They aren't following COVID protocol. And I know people who died in them because the overdose death rates in those places were also quite high. That is hopefully being addressed at this point. I've done a bunch of training of staff at respites on overdose response, and we've pushed for them to get you know, oxygen and some other tools to address overdoses you know, better than they had. But yeah, it's still a huge issue, and definitely not one that's being taken as seriously as it should be. You know, I think we do have food insecurity here, but maybe not on the same level. We do have a lot of infrastructure built up around offering food, in terms of like, you know, just places that offer meal programs as well as food banks. But then I think, you know, again, like right now, my local grocery store is doing a big food bank drive, and that's great. But also people forget that like the food banks were created in the 70s, I think, as a stopgap measure. They were seen as like, we have to do this for the next few years until we can really tackle this problem. And then it's never been tackled. And now food banks are the way it's tackled. But yeah, housing is the biggest one, and not just the lack of housing, but then what housing is offered to people is really substandard and away from the downtown core. There's some exciting new stuff happening with modular housing. There's this one modular housing building that's been built, and I know people who live in it who are happy with it. They are cool with it. So that's maybe a way forward, but until we address the kind of like condo culture in Toronto and the complete lack of building of new affordable spaces, we're going to continue to have this huge housing issue that really works in conjunction with the overdose crisis. And you know, I mean, like was said, like if you don't have a home, you're more likely to use. Like if you're hungry and you're you know, feeling desperate and you're depressed and upset, like you can eat something and it might make you less hungry, but it doesn't take away all the other problems you're facing. Whereas if you know, get high, it kind of takes care of all of that stuff for a little bit. So it's pretty understandable why people find it much more difficult to not use or take breaks when they don't have a sustainable housing.
Maybe one question, unless I'm going to give another pause just to let people join in if anybody else has any questions, because again, I don't want to take up too much space. Miriam, did you have something? No, you're good.
I'm struck by the similarities across these two continents, despite, you know, a complete seasonal opposite. The you know, and I think that there's aspects of severity in Brazil that we don't have here, but we still have. And what I feel like is, what I'm hearing from that is that a lot of what we think is addressed is not addressed, right? It's actually just hidden. It's just pushed kind of under the radar, so that, you know, it looks like we have all these things, but we don't have all these things that we think we have. So I feel like I'm struck by that similarity, and I'm struck by the you know, is there a question I have is, because it's so like you have to like deal with people living from day to day, and it's such a local phenomenon, but at the same time it's an international phenomenon, is what I'm hearing. It like, what is there work going on at that level that anyone is aware of?
You mean in terms of like an international, like making this international connection?
Well, if we're talking about the war on drugs, right? Like what is sort of, is there an international response? Like, is there some coordination of people who are doing this work locally, coordinating with people who are doing it in other cities and other, you know, parts of the world?
Yeah, there definitely is. Sorry, there's a couple organizations. There's INPUD, which is the International Network of People Who Use Drugs, and then they have different groups. So there's CAPUD, which is Canadian Association of People Who Use Drugs. So different nations have their own group, and then they're part of INPUD. INPUD is really not focused so much on Canada. They're focused on other areas of the world where the severity of the issue is much worse. And there's you know, there are people who work for INPUD who are literally risking being killed to do this, the activism work that they do. There's also Support Don't Punish, which is a international organization that works to try to make more, sane and evidence-based drug policy. But it's really challenging because you don't have, the only thing you could do is keep asking and keep showing evidence. You can't, none of these organizations have any real power. And I mean, even the UN has released statements supporting criminalization and things like that, but then nobody follows it. So, and the UN releases a statement on the treatment of indigenous people, and Canada and other nations choose not to follow it. So, yes, that exists, and people do organize and talk to each other, but it's all powerless people doing that. So, it's limited in scope, I guess, or it's an ongoing battle, maybe is a more positive way of saying it.
I like your positive ongoing battle. I don't think I'm in a very positive day, sorry, but I keep thinking about South America. And we had recently a very huge problem in the border with Paraguay, because we have this route for passing especially cocaine and marijuana from the borders, and there's literally a city that is half Brazilian, half Paraguayan, and they are on war because two traffic associations, they are fighting for territory, and people are just dying on the streets and lost bullets flying around. And I think when I think about this, how big are the drug dealers here in South America, then we get to see that it's really a war. It's not just addressing drugs and use. It's where the drugs are coming from and what are the interests in keeping this war, keeping it going on for years and years. For instance, the other day I was hearing a journalist saying that he thinks in Brazil the legalization of cannabis is going very slow because rich companies are buying some time to learn how to produce cannabis and how to sell the products. Because right now, if you legalize in Brazil, people who know how to do it are drug dealers, and they will just take over the market. So discussions are being slowed down by companies because they want to learn about it and then sell the cannabis and all the derivatives. So it's really a huge people fighting for power and territories. It's crazy when you think about. I know Brazil has a very strategic position because we have borders with basically all the countries in South America. And then we also have questions with indigenous territories because drugs go by the forest because it's easier to hide, and then you kill indigenous people in the way, or you just get indigenous also selling drugs, which is another issue. And when it comes to international effort, I know we have organizations in South America dealing with it. But again, it's an ongoing battle that will take some time yet, I think.
I'd say too, there's a lot of talk amongst different organizations in different cities around North America, around different strategies and stuff. So people who've tried to open overdose prevention sites illegally, when we opened Moss Park, we got a lot of other people contacting us, asking how we did it, what are some of the things that have come up that you're going to have to address. And so the model that's used on a lot of the policy that was written and practice that was developed gets shared around, so other places can try to do that. And then different small city-based organizations also talk around, Vancouver has put forward their request for decriminalization, but didn't really involve the voices of people who use drugs in a meaningful way. So that was shared here so that people could try to push internally for that to be changed. So there's a lot of like talk. I think internationally it's harder, but certainly in Canada and going across the border to the US, there is. We've shared stuff with different cities in the US that have been trying to open needle distribution sites or safe use sites or things like that. And I mean, for a long time, naloxone was illegal in Ontario or in Canada, or it was, you know, you couldn't get it. It was prescription only and no doctor would prescribe it. And so an organization in Chicago was illegally shipping us naloxone so that we could reverse overdoses here. So there is a lot of like crosstalk, but it's that to get at that root of the problem around that is the real challenge.
Actually, Matt, you bring up an issue that I'd love to get you to weigh in on and it is around thinking about an internationalist perspective about the influence of the states. I mean, in terms of thinking about pressures against harm reduction or against ending the war on drugs. I mean, there are ways in which it seems to me we're clearly in a colonial relationship to the states in terms of not having full autonomy in terms of making drug policy. And this was something that Samia and Flávia, you and I talked about a little bit about the influence of the states as well. Do you feel like that's maybe changing though, Matt, in terms of, you know, cities in the states are kind of carving out different policies, and you were talking about, you know, that consensus is maybe breaking down a little bit?
Yeah, it's a really weird time because I think Canada often tries to define itself as like in opposition to the United States. Like often our issues are like, well, you know, we have this problem, but we're not as bad as the US, so therefore we're like doing well, right? Like we have racism here, but it's not like the US, so it's like we're doing okay. But in terms of harm reduction stuff, it's like we're doing better than most of the United States, but we're behind certain places. And I just want to shout out Detroit just decriminalized mushrooms, which I think is a fantastic thing. You know, you get like Oregon decriminalizing things like that. So yeah, there's a lot of like really exciting stuff that's happening there. But then that's not the level at which the US really makes that influence on us. It's at that big federal level where they're so reluctant to any change and shift. I mean, I'm hoping if they keep Trump out, it'll have an opportunity to improve. But I mean, yeah, we are still held into our anti-drug interdiction efforts, treaties that we have with them. And so we're out policing the world and, you know, taking people from international waters to arrest them for drug possession. And as we have cannabis legalization at home, we're still involved in cannabis interdiction efforts elsewhere in the world. And so no, I don't think it's necessarily changed in a meaningful way. Hopefully it will though. But we definitely will have a lot to answer for. Like, I think the global drug war can't last forever. It's not sustainable. And as like, when I first started doing this work and I would talk about decriminalization, I would get people responding with either just laughing and thinking I was an idiot, or responding like you know, clutching the pearls, like, oh, it would be the downfall of civilization. Crime would rise to the point that cities would be unlivable. But now when I talk about decriminalization, people are like, yeah, we know all about decriminalization. Let's talk about something more interesting. And with like young people or younger people, I don't know if it's, I think the internet certainly is a big part of it, but just like the access to information that people have, and definitely that they don't get all their drug information from the schools or from the government. There's just such a wealth of stuff out there. I have such hope and faith in young people for really addressing drug policy change in the future. So yeah, I have a lot of hope for this to end, but then Canada's going to have a lot to answer for in terms of like what we've done to the global South, the way we've been a part of policing the world and like just plucking people up and throwing them in jail, or just straight up murdering people, or poisoning drug products. I mean, we've done some really disgusting and underhanded things that need to be brought to the light of day and accounted for.
Awesome. Yeah, great analysis. I mean, Flávia and Samia, could you talk about at least the influence of the United States in a Brazilian context in terms of the war on drugs and what you see in terms of, you know, how the drug war plays out in terms of North versus South?
Yeah, sure. So I think the biggest influence is it happened after George Floyd, because it opened half of the Brazilian population eyes and made the other half like make this comparison. Oh no, in United States they have racism. We don't have racism. You can say we have racism here, and it's absurd because we have a George Floyd every day here. There's a video going on that happened in a small city near Brasilia with a woman and two children, and it's the exactly same scene as George Floyd. The police officer was with his foot on her neck, and she was crying, screaming with a baby in her arms. But yeah, I think the comparison would be more focused on racism, because, and then it brings the conversation to drugs, because the conversation on drugs is not so big here. It's not so open. So starting with the racism in comparison with how the United States are doing, then we have an opening afterwards.
If I may add, I was thinking the other day about an influence, like cultural influence, because we have lots of movies and television shows from the US, like big ones. And if you see like Netflix, they have a few movies, series kind of related to use of marijuana, and like high characters that they don't say they are high sometimes, but you know they are, and we get the reference. And it's like, oh, they are doing this in the US, like the US is developed if they're doing this, and maybe it's fine. Like it kind of opens a discussion in for a few people that have access to this entertainment. Like the other day I was watching a movie with my mom, and there was like this old guy, he was always smoking weed, and my mom was like, hey, maybe I should smoke weed one day to be more relaxed. I was like, hey, what? And it was funny, it was like just as a joke, but as a joke we started a conversation about it. And I was like, if you want weed, like you can just shout out on the street because it's forbidden, but everybody uses, so it's not really forbidden, depends on what is the color of your skin. And she was like, hey, that's actually true, like lots of people are smoking on the street. Like she had never thought about that before. So it's a very like baby steps on discussion, but as we have this cultural influence here, maybe if they are evolving in the discussion, we can also like move together and start to open this conversation. Like I have a hard time to say countries' names in English, but Uruguay, they legalized also, and that had an impact in Brazil because people were like, hey, they're like a tiny country doing this. Sounds so much like Europeans doing that. Like we have this weird references with Europe and the US and Canada, like developed countries. So if Uruguay is doing that, maybe we can also discuss this. And we are like baby steps talking more about.
When Flavia, you brought up actually George Floyd, and I think in our last conversation we started getting into an interesting conversation about how that was impacting the kind of politics of policing, you know, and that really relate to harm reduction. So Matt, you know, I think an example I would give that I've been a bit involved in is that in Toronto's downtown, there's actually been new pilot projects that are actually being funded by the city, incredibly enough, to allow for non-policing interventions to people who are actually in distress, you know, and to me, that so what that would entail is actually instead of calling 911, you call a different number and a street nurse and somebody who knows about intervention can go talk to the person in distress, but also the person who made the call, which is a very different type of, there's a lot of possibilities in that. And that to me is so clearly linked to George Floyd in terms of changing the conversation and possibility around policing. Matt, I don't know if there's anything you wanted to add to that, or if you've seen anything else. Or
Yeah, I mean, I think that kind of idea is great. And I mean, I would love to see a point where there is no ability to call the police and you just call us an outreach worker and maybe a nurse. I mean, the place that I work for, we had a program like that actually a few years ago, where there were posters put around Parkdale saying, if you see this, call the health center. If you see this, call 311. If you see this, call 911. So whether it's violence, call 911. If it's a homeless person you're worried about or somebody who's really high, call the health center and we'll send somebody out. So I think there's some like promise in those types of things. I think the difficulty is that, you can sometimes convince the police brass that things are good, but individual police officers still have a virtually unlimited amount of power. So it sort of doesn't matter, because if that call goes out, you might respond and be doing a good job, but if a police officer shows up, they can just take over and you don't have an ability to say, stop, we have it taken care of. I mean, we have a hard time getting people to call 911 for overdoses because the police come with the paramedics and the police have the ability to pull the paramedics off a scene. The police have to clear a scene before and ensure it's safe before paramedics can go. And so we've had police interfering in paramedics doing life-saving work. And so yeah, it's so hit or miss here, depending on the individual cop you get.
Samia or Flavia, any thoughts on how do you feel like the culture of policing has been impacted? Has there been a better conversation around policing since George Floyd? Have you seen any changes that way?
Yeah, there's been a lot of conversation about this, and maybe Samia will know this better. I don't have all the details, but in Rio, I think it's a pilot project that the police officers there they are using a camera, and from I don't know, like 50 murders, like 50 shots, 50 people that the police shot in 1 month. The next month they shot zero. So the problem was not the crime. The problem was because the police was shooting everybody. And it's like teams of police that work with poor communities and this kind of things. But I think it's a pilot project in Rio. You know more about this?
I know that they were trying this in São Paulo too, so it's a big city with huge problems. And the police in Brazil, like they are related, I don't know how to say that properly, but they have like this military training. So we have a police from the community and the military police. And the military police, they have like this very hard training, and usually they are more violent. And the community police, like from the municipalities and the local states, they're often related to corruption. So because they are local and they are related sometimes to drug dealers or to other power people in the community, and they are sometimes used for police purposes, if I may say, like they do other stuff apart, like aside their jobs. And one of the things is execution. So when you put hidden cameras, well, not hidden, but like when you put cameras, they have to carry like small cameras. They cannot do that anymore. And we had this amazing number falling like 100%, which was very scary because we know these things happen, but we didn't expect it would be like so shocking as it was. And yeah, so we have this also complex situation with the police. Like population doesn't see the police as security. Usually we are scared of the police. We don't trust the police in general. Like even in the more like expensive neighborhoods, like white neighborhoods, if you see police people, you don't stay, like I don't feel safe around them. I just go across the street and keep walking. We don't have a good image and we don't have a good relation. So if I saw someone in the street like with overdoses, I would never call the police, for example. Knowing what I know, I would try to do something, call a friend, like someone who knows a nurse, but I would not call the police, except if I found the person already dead, for example. It's not something we want to do as a population in general. We have this a huge stigma with the police here, and they are known for being like very hard on people, and also these things like they don't help, they clear the scene before calling the paramedics. All these kinds of things are happening here too. So it's another long conversation about how the police should be trained, how we should address other questions. I know there was a project in a few cities to have police from the communities, so they would know the community better instead of just coming and being very aggressive. They would understand better the neighborhood and know how to approach people. They were trying this in a few states on the north, and maybe that could be some kind of solution for the more aggressive approach.
It's so interesting. I mean, in terms of, I feel like, I mean, and Matt or Miriam, I mean, feel free to weigh in, but here I feel like George Floyd was such a game changer in terms of making segments of the population distrust the police for the first time. Like, you know, that it was a way, or at least to make the consensus around policing a little bit less secure. Like, you know, there's a little bit more sense that, you know, maybe people shouldn't trust the police. And so I like, it's interesting to, yeah, just hear that, you know, such a different context in terms of that distrust already being there in such a different way.
I remember when I studied in France, I was there for an internship, and I was always avoiding the police on the streets. And then one day a friend of mine, like a French friend, was like, hey, why are you like crossing the street? I said, I don't like police. He was like, they are here to protect you. I was like, yeah, that's true. I should feel safe, but it was something I had since I was a child. It was so hard for me to think, oh yeah, it's true. Maybe I could trust the police. Then when I came back to Brazil again, I was like, yeah, maybe not here. I don't trust them here. Maybe in other countries they are fine, but here we don't like them. Yeah.
So, I mean, you know, we're getting close to the end, but in terms of, you know, maybe, I don't know, not to end on an optimistic note, because maybe it's just a really hard struggle and there's just like a lot to go, but a lot to do. But in terms of thinking about the context in Brazil, I mean, obviously, you know, you both mentioned Bolsonaro and, or sorry, yeah, like Bolsonaro, there is that election coming up, and would you see hope in the idea of Lula, for instance, being able to return and have a different policy, or do you feel like there would actually be kind of a continuation of the same kinds of policies towards harm reduction and drug supply?
Lula has a history of being, his governments were always very social focused. So I think he would be extremely open for any conversation, for changes in politics. I'm not sure if he's a viable candidate, and I'm not sure if it would be good for him to be elected, because of course anyone instead of Bolsonaro would be good, but there would be kind of a civil war in Brazil if Lula got elected. Because we are very polarized right now. People love to hate Lula, people love to hate Bolsonaro, people hate to love. It's a crazy climate that we are living here in politics right now. But in matters of a kind of government, it has no comparison. Lula would be a better person without doubt. He was the one that took Brazil out of the misery map back in the time, and he had so many programs focused on education too. It was very different government.
I think maybe in terms of addressing the harm reduction, like with these terms, maybe it would be very risky for Lula because he would be coming in a very polarized scenario, as Flávia is saying. So maybe he wouldn't like go straight to some policy or law, but we believe he could maybe work on things that would help the scenario to become more open for people to address social questions like harm reduction, for example. Definitely would be different.
Yeah, one of the biggest critics to Bolsonaro is because his ministers and his advisors, they are not well qualified for the positions that they are. So, and Lula and every other president before Bolsonaro, and I hope after Bolsonaro, would be accompanied by qualified people and people that understand what they're doing in their positions. So from there, we already have a better chance of getting a conversation going on anything.
So it sounds like, you know, there's a part of both of you that are kind of hopeful at the idea of you know, like a Lula presidency or at least like an end to it, but then also it is so polarized that there's fears about what that might bring, and that, you know, it can be kind of risky. Matt, in terms of the, you know, the Toronto context, and, you know, you mentioned like all three levels of government, actually, like John Tory, the mayor, Ford at the provincial level, and then the federal level. I mean, do you see hope at any of those levels in terms of an NDP, like a center left, you know, alternative?
I would love to, but no.
Okay.
Sorry, I'll let you finish your question.
Well, no, that's kind of the question, and you know, maybe just like, do you feel like that's you know, the sense I get is that in terms of like NDP, where it is that the base is ready for that, but actually a lot of the infrastructure of the party just won't allow that kind of change. Is that your view?
I mean, the NDP, I would love to see them get power of some form. I just don't see it happening. I mean, they just do so badly in the polls every time. And I mean, I do see some hope in other parties. You know, I'm not a big fan of Tory for all kinds of reasons, but unlike somebody like Ford, Tory is able to change his mind. Tory is able to be swung with reason and evidence on some things. So like going back to harm reduction, like Tory was opposed to harm reduction. He was opposed to the idea of safe consumption sites. He certainly would not have entertained the idea of decriminalization. But after becoming mayor, he was brought over to supporting safe consumption sites. He has called out Ford for that arbitrary cap of 12 sites in the province and said, we need more sites. So, you know, not my cup of tea, not the guy I would vote for, but at least somebody who can think and reason a little bit. He still gets so stuck on some things like the homeless encampments, and he just can't see past. He's very much about like the rules, and like you don't do things by breaking the rules. And so I think that's kind of what goes on with him a little bit. But he is getting behind in terms of just harm reduction. He's getting behind pushing for Toronto to be a decriminalized zone. He does want more safe consumption sites, and the city has supported the federal initiative to provide safe supply, which is another huge change that's been incredibly positive. So I think municipally we're actually doing like not that so terrible. Provincially, I've got no hope with Ford because he's he's just an idiot. I really hope that we can at least get a Liberal government in. I think the provincial Liberals would be, again, not like my party, but before Doug Ford, we did have me and a group of other people I work with and colleagues did have monthly meetings with the medical officer of health, the provincial medical officer of health, and make recommendations to the province around how to address the overdose epidemic and the drug poisoning crisis. And so they're open to having a conversation, at least, even if they're not always the best listeners. And so, you know, that would be hopeful for me. Obviously, NDP would be great. They've very publicly supported all of these things, or like in their plot, you know, put it as part of the platform, or at least discuss the possibility of it. And, you know, federally, I don't know. Yeah, I'm mostly terrified about a Conservative Party getting in federally and rolling back all the stuff that we've been able to grow, because we've had to work so hard on it. That scares me. I think one of the other things that's frustrating for me is that, like, clearly the issue with our political system is not as polarized as like the US or Brazil. Like, we don't have the same issues with the police, but that breeds a complacency in Canadians, where we have this idea of like things aren't that bad, and so we don't need to push that hard. And is there a really big difference between the Conservatives and the Liberals? And it's like there isn't, but there is, you know. And so even people that put signs up on their lawn saying like, I support my neighbors in tents, well, like, what happened when they were moved out of the park violently by police? Like, you didn't stand up, and is that really going to change the way you vote? So, you know, John Tory, there's been some discussion about the homeless clearings, encampment clearings, but it's not really being held to task for it in any kind of meaningful way. So I don't know if that's an answer.
No, that was a very good, clear answer. So yeah, as we're wrapping up, you know, I just want to again like open it up to anyone, like any last thoughts or any last questions for anybody. Oh, Alice, yeah, I see Alice. Oh, you're muted.
Okay. Just came to tip in my 20 cents. I work as a caseworker at a hotel shelter program in downtown, and I'm from Brazil. So like hearing you talk, having this conversation, so it's the two worlds that I've seen when I was home and I see now here. So it's heartbreaking, but I don't think like anytime soon we'll have safe injection sites open, for example, or SOS AOT programs being created in Brazil. I don't think they are not ready for this conversation. So I'm just grateful for people like Samia and Flávia who are there and who are advocating for these people, because those are the ones that we can count on. That's what I believe. I don't think like we are doing way better here in Canada. I believe far from being ideal, I would say, but we are doing, I think, a little bit better in terms of we don't have anything such as social welfare in Brazil, you know. So having like a place like Parkdale, we have so many clients who access your services, so many clients. We don't have these places there, you know. So it's just like, thank you to Samia and Flávia for doing that for the people who are experiencing homelessness or who really need their services. So kudos to you, well done. So thank you.
Thanks for joining, Alice. Anything else from Tina or Jules or Miriam?
Just wanted to say thanks to all our panelists, just for open my eyes to a great deal of, you know, kind of what's going on right underneath my nose in my own city, and also what's going on, you know, in Brazil, and just making me much more conscious of the conversation that I need to be having as I move forward. So thank you for that.
Yeah, and I'll just thank the panelists as well, just in terms of what a great conversation this was. I feel like, again, you know, I've learned so much, and I really do feel like that comparison just is so useful in terms of understanding both the way things are the same and the way things are different, and there is a feeling of solidarity in terms of understanding that, you know, the struggles are connected, and the issues, they are related. It is an international problem in terms of. I see something from Jules. Yeah, absolutely. Any last words from the panelists, just to finish things off before we say goodbye?
Yeah, just to say thank you, Andrew, for putting this together. I still have the feeling that we could go on and on with the conversation. Maybe you have to come to Brazil, or we'll go to Canada and talk a little bit more. And I have the same feeling as Miriam, like seeing another country. Alice will know what I'll say, like Canada is so developed and they have no problems. Canada is perfect. And no, you are not perfect. And society is like this, but somehow it gives me hope that you are already a step ahead of us. And hopefully one day I will call Matt and ask for tips how to open a free space re-injection site. I don't see this happening anytime soon, but hopefully one day while I'm still alive, I will see this happening and people will feel more comfortable about talking about their needs, and we'll have this more like healthy discussion in society. And so like talking to you gives me hope of one day maybe we can go there. And yeah, thank you so much for the opportunity.
Flávia, Matt, you're good? Nothing to add?
No, Samia represented me. I'm good. Thank you. Just say thank you.
Yeah, I just wanted to say thank you, Andrew. Thank you, Samia. Thank you, Flavia. It's really nice talking with you all.
All right. Well, with that, we'll say goodbye. Thanks again. And I'll be sharing the recording with everyone in case you want to